Hey y'all, and welcome back to my channel. On this page, I talk about technology and money. If you're new here, please subscribe to the channel and also like and share this video. Liking and sharing the video does two things. Number one, it helps this content get out into the YouTube algorithm and it reaches more people, and you are actually adding value that way. And then it also encourages me to continue creating content that you all find helpful. So today I wanted to talk about a comment that I received to a video I did a couple of videos ago on the name of that video, and if you have not seen it yet, I will link it above here in YouTube. But that was a video I did on actual job titles of nurses working in technology, and that was a requested video. So there were some comments that I got to that video, and then also got a message. So as always, it's easier. It's just easier to create a video response because it helps more people. It doesn't just help that one person. If I just message them back directly, it actually, sorry about that. It actually helps more people. Okay. So you can go out and read that comment. I'm going to read it here. But like I always say, in previous videos, they're just in general with anything that you come across on YouTube, on social media, etc. Do not believe everything I say, or do not believe everything that you see on social media. Always do your own research, do your own, check with multiple sources, check with different types of people. And in the case of this question that this person asked that I'm going to give a response to, just check with different types of people, right? That gives you a better chance of having a balanced response. So then you can I just feel like when you have a reasonable amount of responses or options, it's just better, okay? Because you're not just operating from one source. Okay, so is nursing informatics, or even more broadly, is informatics right for me? Okay, so let me just read the comment that this person left. So this person is a registered nurse, I do believe. I think they're based out in the Midwest. So they said, is it a good idea to major in informatics if you're just okay with computers? So they go on to say they were thinking of getting their master's in informatics to become better at EHR, become better at technology, because they know that's where healthcare will be completely. And I agree with the latter half of their comment, because just in the digital in the landscape itself, in healthcare IT, hospitals and and doctors' office and organizations, they have their incentives from federal regulatory agencies to have an EHR and to have platforms. And in some states, I know hospitals are required to they share de-identified patient data with the state for different things around surveillance and tracking and population health. So among many other things. So I do believe, and beyond that, many organizations have like whole entire departments within their healthcare organization, related to creating digital content for patients, ensuring that their electronic health records are accessible to the patient and the patient's loved ones in many different ways, in different languages, also for patients who may be deaf or hard of hearing, or blind or low vision. So yes, I agree with that, the second half of the comment. So this video is going to be around three things. I actually came up with 10, but assessing if informatics or nursing informatics is the right career option for you, or even if pursuing an informatics education is the right option for you. So And I'm going to say I came up with 10 different options. I came with 10 different things for this person, or for even for yourself to sit and think about. But just for the sake of brevity in this video, I'm only going to give 3. And if you want to hear the other 7, or if you want to talk more, you can definitely send me a message, and then we can then talk a little bit more about the other 7, or you can ask additional questions. So yeah, so that's that. And I also want to preference, because I know this person is a registered nurse and they're looking to further their education in informatics and get into an informatics degree, that you do not necessarily have to have a master's degree to work. And I'm going to share my screen, okay? While I'm sharing my screen, I'm going to keep talking. You don't necessarily have to have a master's degree to work in technology if you're a registered nurse. Okay, you do not necessarily have to have a master's degree, and I want to make that very clear, because I know right now I'm actually working with nurses right now, or I know nurses who work in organizations and they do not have a master's degree in informatics or nursing informatics. Some of them are certified in nursing informatics by the American Nurses Credentialing Center. Some of them are not certified. All of them have experience, right? So they either got experience on the job, or they worked at other organizations. Maybe they were super users. And to that point, I just Googled nursing informatics careers. I literally just did a Google, right? And I came up with all of these. I hit on a ton of positions out here on Indeed. Now, just a disclaimer, I don't know this organization. I don't know, so I'm not being compensated in any way to look at this job description. So I want to make that very clear, okay? So just looking at this health informatics nurse position, it looks like it is out in the Midwest, and I just read through several of these job descriptions. I mean, I know that you don't have to have a master's degree or be master's prepared to work in informatics, but I just wanted to show you all, just by Googling or just looking at different positions, that you don't necessarily have to have an informatics master's degree, okay? Because this person was very specific in their comment and question about the master's degree portion. But see, this position that we're looking at for a health informatics nurse, it asks for a master's it asks for a bachelor's and or master's degree. And then along with the additional qualifications. So I'm pointing that out to show you all, pointing that out to show you all, you don't necessarily have to have a master's degree, okay, to work in informatics or be a nurse or working in technology. And I feel like it's really important to point that out, so people, so that this person or other people don't feel discouraged. To say, as they're learning more about nurses working in technology or clinicians working in technology, I don't want anyone to feel discouraged if they feel like, well, I don't have that, so I'm not prepared. And I've said this before in an earlier video. I think it was maybe my very first video that I posted. There are many different paths to the same destination. You don't necessarily have to have the same path that someone else did, okay? So I just that's just a little bit of encouragement to you all, just so you know, you don't necessarily have to have a master's degree to work in informatics or health IT. It helps, but it's not required. And again, I know people who are working. And the other thing, before I get into these 3 points, is just keep in mind, it's not just you being the right fit for a master's program or a healthcare IT job. It's also the master's program or that job being the right fit for you. For example, what do I mean by that? When I was in nursing school, I was a CNA, like many of us do. So I was a certified nursing assistant. So I had the skills. So I did home health. I was a home health aide, and I did it for 1 week. And I knew after doing that working in that specialty for a week, that home health was not for me. I had the skills, but it just wasn't the right fit for me. So, all right. So let's get into, I'm gonna stop sharing my screen. All right. So let's get into so let's get into these three questions. Okay. So number one, ask yourself, do I have a good baseline understanding of what it is a nurse informatician or a healthcare informatician does? Just really just sit with yourself, spend some time thinking, do I have a good understanding of like what a person in this role does? And then if you're honest with yourself and you can answer that question, then you ask yourself, would I enjoy doing that work every day and or on a regular basis? So just to further expound on that, just a little bit of story time. In my first nursing informatics role, many years ago, 18 years ago, some of the work that I did was I assessed workflows. I spent time with nurses and other clinical people, physicians at the bedside in their clinic, just observing and watching them work, taking notes down on paper, writing out their workflows, and then I would then build out or document out those workflows in a software program. I did assessment of clinical operational gaps and made technology solutions. And sometimes the technology solution for an issue was not always saying, okay, you need to go out and buy this clinical system. Sometimes it was just assessing a clinical operational gap and then looking at the existing system to see where that system can be enhanced or upgraded to then fit that or to solve that gap in clinical operations. Built relationships. That's something that I do even to this day. I do a lot of relationship building. I did a lot of testing of fixes, like doing a lot of break fix testing, meaning trying to break a software upgrade or a system and or trying to fix if there was any problems. So you ask yourself, that's just very high level. Ask yourself, is that something that I would enjoy doing every day? Right? Because what you don't want to do is invest time and energy and money into a master's program and you get the degree or you're halfway through the degree or even like a semester into the degree and realize that that's not for you. And then those things that I just mentioned are some you may not be able to get back. So number two, ask yourself, do I have a mentor or someone in my network to help guide me? So a mentor or someone in your network these are people who know your baseline skills. They know what you're capable of. They know your past or current performance because you've built that relationship, and then they can help talk you through if making a move in that direction or applying to that program or enrolling into that program is the right fit for you. They can help you figure out how to get a shadowing opportunity, how to assess if a job, even if you don't necessarily have the master's degree, like that first position we looked at, if that position would be good for you. They can just help you. It's just good when you have someone that you built a good, strong relationship with to kind of talk through, like, I'm looking at this master's program and, because I want to do X, Y, and Z. And what do you think? And get some feedback. Sometimes it's really nice to talk to someone that you know and that knows you to help you process and talk through if something is the right fit for you, and or if you're the right fit for it, and if it is the right fit for you. And just one other recommendation around that option, just take some time to review nursing informatics positions or health informatics positions like I just pulled up on Indeed. Take time to review professional organizations around informatics, HIMSS, the American Nurses Informatics Association. Just take some time to look at that content. Read a few articles, very high level articles. Look at some YouTube videos. Share this YouTube video with someone you know who may be considering. And I actually did a video a while ago, and I'll link that one again. above here in YouTube about just resources on where you can go to learn more about the profession of nursing informatics. So yeah, so definitely do that. And then number 3, the final thought is shadow some classes. So this is really key. Like, this person is considering a master's degree program. And so I definitely recommend, if you find a program that interests you, you know, is within your cost range, is convenient for you to attend, it fits your work schedule, if you're planning to work part-time or full-time, you know, see if you can shadow some classes and sit in a couple of classes, not just one, but just sit in, you know, a few classes, maybe 2 or 3, taught with professors. Talk with current and former students if you can. And I talked about that in another earlier video about assessing a master's degree program. And don't just talk, if you're considering a master's degree program, don't just talk to the recruiter or someone in student services. Definitely talk to people who have actually gone through and did that work, or someone who's actually teaching the content. Ask questions. And I definitely recommend that no matter what you know, if you don't get a master's degree in nursing informatics or health informatics or clinical informatics, any program that you enroll in, if it's an MBA program, do all of those things. Just spend some time to really assess it before you invest your time, resources, and energy. So yeah, that's it, y'all. So I hope this answered this person's question or answers you all's questions. If you have any additional questions or comments, you can either leave a comment or question below. You can also message me. I'll leave my contact information in the description box. Okay. And I'll see you in the next video.